you in terms of telling you a little bit about our program, and hope we can see you in Texas and make it happen. I think that, I was saying before that it's exciting because we having a baby is like life changing, and we take it very seriously, and we really are dedicated to helping you get through, to make it happen. So our main office is in Frisco, actually right across from where the Cowboys just moved their headquarters. We have 3 embryologists, full-time embryologists, a very large IVF lab. We see a lot of do a lot of surrogacy and egg donation. Why Fertility Specialists of Texas? Well, I think I was saying before, we have excellent success rates. It's not 100%, but we are, because of our, there's a physician component and a laboratory component, and we, particularly when you're using an egg donor and a gestational carrier, majority of the people should get pregnant, if not when you do the fresh transfer. Certainly when you're using, you have other embryos that are frozen on a second transfer if you're transferring a single embryo. We also have an in-house egg donor program, so those are people that we have screened ourselves. But I also tell patients that are, if you're looking for someone that's 6'2" and has an SAT score of 1800, we probably don't have that person. So we work with a lot of different donor programs. The screening is really the same. Everybody, are screened really the same, so it doesn't matter to us if you want to use one, like our egg donors, or certainly from a program. We do work closely with men having babies. They've done an excellent job, I think, from an informational perspective in terms of providing you information that's not biased. We work with the Gay Parenting Assistance Program and do 2 pro bono cases per year. And obviously we work with a lot of surrogacy agencies. The last thing is really in terms of guaranteed programs. I know that it's very, it's a lot of emotional energy, a lot of financial energy in terms of going through this process. And so certainly if somebody is, because of our success rates, we're able to offer money back, or guaranteed programs where we basically partner with you in saying that this is what we're willing to do, and we feel very strongly that we can get you there, and we're going to do what we need to do. And if not, then we'll refund the cost that's associated with that. So what is it like when you have your first visit? Initially, we typically schedule you when you have your first visit for doing a sperm count, and we'll have that, give you the results the next day. And at that time, it's also very convenient to freeze your sperm and have that done. So whether you live, in Texas or live anywhere, really, that we have that taken care of, and we don't need to worry about that. As part of that, you'd also have lab tests, and we have to do a brief physical examination, and then that part is taken care of. You meet the team, which would involve Marissa as part of our third-party program. She's in the back. That's very involved in terms of communication, because it's a lot of moving parts. Typically, patients come to us either, you see us and we refer you to a surrogacy agency, or you see a surrogacy agency and they refer you to us. We go through and we start off with making embryos. And so you would select an egg donor, and that egg donor would be placed on medication. And the third thing is placing the embryos into a surrogate. So providing sperm, freezing that. Second thing is making embryos. And the third thing, which is the fun part, is transferring them into a surrogate. Again, we have in-house egg donors that are pre-screened. There is an advantage of that there's not an agency fee associated with that, but we don't have a selection that donor agencies. We don't go to UT, or we don't go to Florida, to Gainesville to look at egg donors. And so agencies typically definitely have a larger pool, but in terms of what they or how they're screened really the exact same. So a little bit briefly about the process of IVF. I know you've heard a lot, but when you talk about making embryos, so that means you've already, your sperm is already frozen. We obviously would want to know the important things of the visit is one is freezing sperm. Second thing is talking to you about the process of IVF and whether you want to do genetic testing. And the third thing is whether you're, in terms of making sure that getting an understanding, for example, of like selective reduction. In terms of the process of after you've already seen us, then one of the reasons why communication is so important is because you've selected an egg donor, but you're not actually there when the egg donor comes and sees us, so it's important that you have a team that'll keep you informed in terms of, okay, your egg donor came in, we met her, the information basically is consistent with what they told us from the agency, and it looks like everything is good. In terms of after the egg donor has been screened, and we basically, the IVF process is basically the egg donor is placed on medications to stimulate her ovaries. After about 10 days of medication, then she goes through a process where we retrieve those eggs using a small little needle that goes through the back of the vaginal cavity. And typically, average number of eggs in our program is 17. The range is between 10 and 25. So let's say you had 18 eggs. So not all of those eggs are going to fertilize. You might have 15 that are fertilized, and you can see in this picture, these are all pictures from our lab where the fertilization is done with ICSI, where you can see the little, there's actually, if you look real close, there's a sperm, a single sperm in this pipette that's used to fertilize the egg. And then you have embryos, so you may start off with 18, 18 eggs, let's say 15 fertilized, and then they are evaluated on day 3 and day 5, and this is what embryos look like on day 5, and the range you can have on day 5 is anywhere between 2 to 8 or 9 embryos that are at that time, either on day 5 or day 6, are frozen. Now, prior to freezing them, they can be biopsied, and we do a lot of genetic testing. So they can be biopsied where you take a cell from the outside of the embryo, and they're sent off to a lab, and then we get a report about a week later. This is our embryologist, and next slide. And so after that, then we get a report, and we typically would talk to you about the how many, for example, let's say you're doing split insemination, you may have 4 embryos, you may have 2, or it could be really the other way around. And then the next part is actually is hopefully concurrently that we've seen the surrogate and gone through the screening for the surrogate, and then do the fun part, which is really the embryo transfer. Embryo transfer just involves coming into our doing a transfer, and 10 days later you get the results. Usually the intended parents, y'all are there. Ideally it's nice if you're actually there, but a lot of times we have patients that like Skype the transfer, and then hopefully they're there for when you do the OB ultrasound, which is like a very emotional moment, really. What are the factors that infant success? Is one is the egg and sperm quality. By and large, you're talking about using an egg donor that has the best egg, sperm. Very rarely is there an issue, unless it's profoundly low, that the sperm really affects the quality of the embryo. IVF laboratory is really important. You'll notice that there are differences in success rates between programs, and that's because the environment that's created for the embryos can be different. Cycle monitoring is important. If we have obviously we do monitoring here in our facility, but also there are times you can have an egg donor that lives in New York or lives in California, and they usually would do that at their facility. The gestational carrier is important, and they go through screening and the embryo transfer. Success rates, using it's really between 70 and 80%. Using an egg donor, gestational carrier, by and large, the pregnancy, if you're doing a single embryo transfer, for example, it may not. Most of the time it happens the first time, but not all the time. But if they're not pregnant, then so you do a transfer the following month. So it can take a little bit. It may take longer if you're doing a single embryo transfer, but certainly, and I'm sure y'all have heard this over and over again in terms of safety-wise, that it's really the safest thing to do. So I wanted to kind of open up in terms of questions. I know that it's a very daunting, or it can seem very overwhelming. I think that we, again, it's like enjoy what we do, because we really feel like that that we're changing lives, and having a baby is like really amazing process. So I wanted to, if y'all have any particular questions, then I'm certainly happy to talk to y'all even here or individually out after the breakout session. Questions?
Where in Texas are you looking?
Dallas.
Yeah,
So,
3 offices.
yeah, we have 3 offices in Dallas, but our main for third part, is like in a Frisco office. But we're in Dallas. I think that one thing that's initially a lot of times when you think of, like, if you need to see your internist, you're not coming to Dallas to see your internist. But when you talk about IVF and third party, it really doesn't matter where y'all are at. In other words, because it's not like, you come to Dallas at least once, and ideally, like I said, if you're doing it, hopefully your surrogate's pregnant, then you know that you're there when she has like her first embryo, when she has her first ultrasound, and maybe like when she's 18 weeks, and obviously at the delivery. But I think that the important part is really the program that you're dealing with. The surrogacy agency is very important, and whether that resonates with you, whether you feel like that you're with a program that's going to stick with you, and that's committed to making it happen one way or the other. Because really now in 2018, it's not like it was 15 years ago, where people would go through and spend a ton of money and maybe not have anything. In 2018, it really should not necessarily be that way. It may not happen the very first time, but it should happen. So that's and that's what we want to happen. Any other questions?
How long have you been in business?
Since 2000, I've been practicing as a reproductive endocrinologist since 2000, but we've been open since 2005. So I started off, I did my fellowship in Vermont, and I was faculty at WashU for a couple of years, and then I turned 40, and my wife had a baby, and so we moved back to Texas, and I started off the practice myself, and now I have two doctors, and another doctor is joining us in July. But we are really committed. I think that what makes us differently, even in Dallas, is we don't want you to be a number. We don't want to be the Southwest Airlines of fertility. It's like that. We want to help you, help you make it happen.